Hi everybody, Dr. Diane, Lyme and mold expert here talking about NAD. NAD in combination with Lyme and mold treatment can be amazing. So a lot of people are talking about NAD for its utility of supporting the mitochondria. It is amazing at this. It's a mitochondria superfood. Now, essentially, remember the mitochondria are the powerhouse of the cell. Essentially, what this means is that the mitochondria are responsible for a huge step in the energy production of the cell, right? And when the cell has energy, the cell can do its job. This is true across the board, cells, every cell in the body, right? So we always want to get to the root cause. And when we're dealing with Lyme and mold, the root cause is often that Lyme, other infections, mold, other toxins. However, when we have chronic infections, when we have chronic toxic buildup, parts of the body get damaged. The mitochondria are one area of the body that can get damaged. When this area of the body gets damaged, then the mitochondria do not work as well. And simply going in and eliminating Lyme and eliminating the toxins oftentimes is not enough to repair the mitochondrial damage. So it's not infrequently that we have to go in and actually turn the mitochondria back on. In fact, many times in treatment, when people think that things are not working, the Lyme is actually in remission and the toxins are actually mostly gone. And the problem now is that we haven't gotten to the mitochondria. We know this, of course, when we test and we're working with a clinician who can evaluate all of this, but I do see this very frequently that the damage left over by these types of scenarios is truly the fundamental problem, that we've actually gotten rid of those root causes. Now we need to repair the damage. So NAD is a wonderful way of turning the mitochondria back on and improving that dysfunction that can happen because of these infections and toxins. However, we have to be careful. NAD will widespread turn off methylation. Anybody that has studied detox understands that methylation is a very important component and say part of the detoxification process. So we get around this by supplementing with something called TMG. TMG will help to provide that methyl support when you are giving the NAD. Now, I find a lot of people get worried about things like TMG when they have situations like MTHFR. I've actually found that a lot of people with MTHFR abnormalities work with TMG very well. As always, you want to go slow, you want to see how your body responds, but you definitely want to work with something that is going to help to turn on methylation if you are doing niacin, if you're doing NAD, because you can actually find that while your mitochondria might turn on, something else might turn off, like detox or methylation, and you could run into other problems. Some people do really well with IV NAD. It's definitely going to be your biggest punch, but I've seen some people get really good benefits from other delivery systems such as oral, liposomal, sublingual. I even have a patient doing subcutaneous. So there's many different ways that you can get NAD into your body. And you, as always, you want to make sure you're working with your care provider who knows your whole situation. Go slow. Remember, not everybody responds the same to everything, but for many people, this can be that thing that turns off fatigue, turns on libido, and just helps people start thriving again post Lyme and mold treatment. Now, if you have mitochondrial dysfunction and you have not fixed the root, what will typically happen is if you give NAD, you might get a boost and you might feel good for a few weeks and then you'll crash again. If that's happening, oftentimes that's a sign that you have not fix the underlying root causes, what's causing that mitochondrial dysfunction, and you need to go back and fix those before a treatment like NAD will hold. So that's it for now. Please do subscribe if this has been helpful. Thanks again. I'll see you in another video.